Today I will be discussing schizophrenia. The history of schizophrenia. It is a debilitating neuropsychiatric illness that typically strikes young people just when they are maturing into adulthood. It affects 1% of the population. This disorder is associated with marked social and/or occupational dysfunction, and its course and outcome vary greatly. It involves motor, cognitive, or social impairments. They are often observed but not severe enough to place affected people outside of their normal range of functioning. There is a substantial functional deterioration in self-care, work, and interpersonal relationships, especially during the first 5 years. History continued. There is 10 to 15% of people with schizophrenia that take their own lives. It is a neurodevelopmental disease with significant abnormalities in brain structure and function. It is highly hereditary. Males have a 5.1% chance of getting schizophrenia versus women who may have a 5.6% chance of getting schizophrenia. What are the positive symptoms of schizophrenia? Believing that what others are saying is not true, delusions. Hearing, seeing, tasting, feeling, or smelling things that others do not experience. Hallucinations. Disorganized speech and behavior. Men show it in their teens and early 20s. Women show symptoms in their mid-20s to early 30s. One might have interferential thinking, disorganized, incoherent, and illogical speech, thought disorder. What are the negative symptoms of schizophrenia? Losing interest in everyday activities, bathing, grooming, or getting dressed. Feeling out of touch with other people, family, or friends. Lack of feeling or emotions, apathy. Having little emotion or inappropriate feelings in certain situations. Having less ability to experience pleasure, insomnia, unexplained hostility, sensitive to noise and light, self-inflicted harm, and escapism. What are some most common drugs used for schizophrenia? Invega Trensia. This is the only medication that helps control symptoms of schizophrenia for 3 months in just one dose. The side effects are there's an increased risk of death in elderly people who are confused. Memory loss, lost touch with reality, may affect your ability to make decisions. One cannot think clearly or react clearly. Uncontrolled movements of tongue, face, mouth, or jaw. What is another medicine used for schizophrenia? Rexulti. Side effects are stroke in the elderly, MES, uncontrollable body movements, high blood sugar and decreased blood pressure, seizures, weight gain, and muscle spasms. There are many psychoactive medications that can be used, such as Abilify, Eprozole, Cariprazine, Latuda, Seroquel, or Risperidone. Other ways to treat schizophrenia without medication. Psychosocial therapy. Injections may be needed if one does not want to take the pills. Social skills training, ability to participate in daily activities. Family therapy helps families cope on a day-to-day basis. Vocational rehabilitation and supported employment. Prepare for, find, and keep a job. Electroclusive therapy is also included. Can one recover from schizophrenia? With these drugs, people can function as normal as possible. People can learn to manage their illness and cope with their symptoms symptoms as long as they follow their treatment plans. What is the mortality rate? 2 to 3 times higher than with any other diseases. They have a high level of suicide is also reported, and in natural course of the illness, rate of spontaneous recovery might increase if one is treated. Brain chemistry behind schizophrenia. Imbalance of one neurotransmitter, dopamine, is thought to cause the symptoms of schizophrenia. Serotonin, a neurotransmitter, may also play a significant role. Far more neurotransmitters are released between neurons. Antipsychotic drugs are designed to intercept brain transmitters that communicate feeling and actions in the brain. Medications, researchers think that they will affect the balance of certain chemicals, which includes neurotransmitters. I have discussed all the different aspects of schizophrenia. Thank you so much.